If your skin looks like this, you may have a dangerous form of diabetes. Imagine waking up one morning to find a peculiar change in your skin. It's not just a small mark or a temporary irritation. It's something more significant and unsettling. What if I told you that your skin could hold the key to uncovering a dangerous form of diabetes? Have you experienced unexplained sores or an unfamiliar rash on your legs? Could these be hidden signals that your body is desperately trying to communicate? We'll explain how these symptoms are connected to diabetes and the signs your body is using to indicate its cure, so stay tuned till the end and don't miss any of the symptoms. Prompt and effective treatment is crucial in managing bacterial skin infections, particularly for individuals with diabetes who are more vulnerable to such conditions. Common bacterial skin issues include styes, which are infections of the eyelids, boils, nail infections, and carboncys, which are deep infections affecting the skin and underlying tissue. These conditions display noticeable symptoms such as heightened warmth, redness, pain, and swelling in the affected area. Fortunately, most of these skin problems can be effectively treated using prescribed antibiotic creams or oral antibiotics. This treatment approach helps combat the infection and alleviate the associated discomfort. It's important to promptly seek medical attention to address these issues and prevent any further complications. By following the prescribed treatment and care, individuals can experience relief and an improvement in their skin's health. Individuals diagnosed with diabetes are more prone to fungal infections, specifically those caused by Candida albicans, a fungus that resembles yeast. Such infections typically appear as reddish, itchy rashes accompanied by small blisters and scales. They commonly affect areas of the body that are warm and moist, such as the armpits or the spaces between the toes. People living with diabetes face an increased risk of developing various fungal infections, including ringworm, jock itch, athlete's foot, and vaginal yeast infections. To effectively address these fungal skin problems, it's highly recommended to seek professional medical assistance. Consulting a doctor who can provide an accurate diagnosis and recommend appropriate treatments is crucial. They can prescribe suitable medications to eliminate the infection and provide guidance for alleviating discomfort and promoting the healing process. However, have you ever lost your skin color? If you're not getting my point, then stay tuned till the 8th symptom. Before that, do you feel itchy every time? Well, here's the answer why. Itching on the skin can stem from various factors. For individuals with diabetes, potential causes may include yeast infections, dry skin, or inadequate blood circulation. When poor blood flow is the underlying issue, the lower legs often experience the most intense itching sensation. To alleviate this discomfort, several measures can be taken. First, reducing the frequency of bathing and opting for mild soap when necessary can help. This prevents excessive drying of the skin. Additionally, applying moisturizing lotion can be beneficial for hydrating dry skin. However, it's important to avoid applying lotion between the toes, as this can create a moist environment that promotes fungal growth. Diabetes can result in neuropathy, a frequent complication characterized by nerve damage. In some cases, neuropathy leads to diminished sensation in the feet. This means that if you accidentally stepped on an object or developed a blister, you may not perceive any pain or discomfort. Consequently, the absence of pain awareness increases the risk of developing a foot ulcer, an open skin sore. Engaging in regular foot inspections is crucial to maintaining foot health and preventing complications. It's recommended to diligently examine your feet each day, paying close attention to any indications of injuries or the persistence of ulcers. By performing these routine checks, you can promptly identify and address any potential problems before they escalate. This proactive approach to foot care is essential, particularly for individuals with diabetes, as it helps mitigate the risk associated with neuropathy and reduces the likelihood of developing serious foot conditions. People with diabetes may experience a condition called bullosis diabeticorum, which involves the development of blisters on the skin. Most of the time, these blisters show up on the fingers, hands, toes, and feet, and sometimes on the legs or wrists. They resemble burn blisters and are typically painless, healing naturally within a few weeks. Individuals with diabetic neuropathy are more prone to these blisters. The good news is that maintaining healthy blood glucose levels is the primary treatment for this specific skin issue associated with diabetes. By now, you've realized that diabetes causes many skin-related issues and color loss is one of them, so wait till we disclose that. But before that, have you ever heard about eruptive xanthomatosis? If not, then listen to the next symptom. Eruptive xanthomatosis, a condition that manifests as a firm, pea-like skin growth, can result from uncontrolled diabetes. These growths frequently have a red halo and may itch. They usually appear on the back of the hands, feet, arms, and butt. This skin issue predominantly affects young men with high cholesterol and significantly elevated triglyceride levels or fat in the blood. The primary treatment for these skin sores involves bringing blood glucose levels under control. Additionally, your doctor may prescribe medications to lower cholesterol and triglyceride levels, and you should follow that for the cure. Approximately 1/3 of individuals with type 1 diabetes experience a condition called digital sclerosis. The condition is characterized by the development of thick, tight skin that can feel waxy and usually occurs on the back of the hands. As a result, the finger joints may stiffen, making movement difficult. In some cases, this skin issue can also affect the toes and forehead, although rare stiffness can occur in the knees, ankles, or elbows. Maintaining good blood glucose control is the primary treatment for digital sclerosis. Additionally, using moisturizer may help soften the skin and alleviate the discomfort associated with this condition. Disseminated granuloma annulare is a skin condition characterized by the presence of raised, bumpy, or ring-shaped spots. These spots can vary in color, ranging from skin-colored to red or red-brown. The most common areas affected are the fingers and ears. Some individuals may experience mild itching. Fortunately, in most cases, medical treatment is unnecessary as the rash tends to resolve on its own without leaving any scars. However, it is recommended that you seek medical advice and consult your doctor regarding the potential use of a topical steroid, such as hydrocortisone. This consultation will help address any skin issues and improve the condition effectively. And now finally, we talk about color loss. Vitiligo is a skin condition characterized by the destruction of cells that produce melanin, the pigment responsible for skin color. This results in irregular and patchy depigmentation, commonly observed on the hands, face, or chest. The exact cause remains unidentified, but medical professionals believe it shares an autoimmune nature similar to type 1 diabetes. A study published in July of 2016 in the Journal of Biomed Research International investigated the possible connection between these two conditions. Presently, there is no definitive cure for vitiligo, but treatment options like light therapy and the application of steroids have shown effectiveness in managing its symptoms. It's important to note that individuals with vitiligo should prioritize sun protection and by regularly applying sunscreen with a minimum sun protection factor of 30. This precaution is crucial since depigmented skin lacks the inherent natural defense against harmful sun rays provided by melanin. By seeking medical advice, you can address all of these issues promptly and potentially prevent the development of diabetes-related complications.